Good evening and welcome to the rest of the news. We have a really terrific program for you tonight. Our special guest is Mike Clark. And Mike, tell us a little bit about what you do.
Well, I'm a marriage and family therapist here in Louisville. Been here about 28 years. I've been connected with New Life Ministries for a number of years, working with their Every Man's Battle workshops and dealing with sexual addiction and pornography. And been working out of a local church here in town for about 17, 18 years.
Medicare is just going through open enrollment, and I had to get a new policy, so that kind of tuned me into Obamacare a little bit. Okay, I used to have what they call a Medicare Advantage program, which was not too expensive, but a couple of months ago, I had to get an X-ray, and they paid zilch on it. They didn't pay a penny on it. And before, they used to pay for everything, or lots of it anyway, most everything. Okay, so I said, well, I'm going to have to get a new policy. So I tried to get a new policy, and they are expensive. It's costing me, I think it was something like 10 times more per month to get a Medicare policy that would give me better coverage and do away with some of the co-payments and things like that. And then I had to get another policy for the medications. Okay, so I'm saying to myself, what's going on with the medical situation here? And I believe that a lot of this is due to Obamacare coming in, and basically the insurance companies are trying to make more money so they can pay for all the new people that are not paying into the system.
Well, I heard something in my dentist office the other day that if you have stock in some of the insurance companies, they're making profits. And my response to him was, more likely it's because everybody's having to pay extra premium, higher premiums and higher deductibles. So that means the insurance companies are not paying out as much.
Right.
So their stock would go up. And so, I don't have stock in it, but, it's a natural, response to that.
Well, and I think, as I understand it, the government has told them if they do, start losing money, that they'll kick in taxpayer money to make sure.
Our tax money.
Yeah, that they don't go completely bankrupt.
Well, something that I heard in the last year is that people who go into the hospital, you need to be very careful, especially if you have an elderly loved one or anyone, is if you go in there and they say that they're going to put you under observation, ask them the question what they mean by that, because from what I heard, if they have you under observation, it's your nickel.
That's right.
If you're not admitted into the hospital.
I had a friend that happened to.
If you're admitted into the hospital, then your insurance is going to be covering whatever it's agreed to pay.
Yeah.
But if they just say that you're going to be under observation for the next 5 hours, 10 hours, 24 hours, whatever, it's going to be your nickel that you're going to be paying. That's going to be paying.
Which can be thousands.
And that's a new aspect of the new Affordable Care Act, as they call it, in regards to that. So, there's different things that they're changing midstream that they're not really letting people know that, as everybody said in the very beginning, I have this insurance plan. I like it. I've used it. It works well with me. The premiums are affordable. And now, we were promised, as all of us have heard, throughout the time that is being promoted, you keep your doctor, keep, all those things that you normally have. And then after it was voted in, well, we began to find out what the truth was.
Yeah.
Is that
you don't get to keep them.
You don't get to keep your doctor. Your medications are even restricted as to what you can,
Right,
get
and your
prescribed.
policy is costing you more and it doesn't pay as much.
Well, one of the concerns that I had from the beginning, I worked with some insurance companies, is that, and again, this was in before any of it was really implemented, but they were questions that I was asking. With what they were saying is that the premiums were going to be increasing. Okay, if they go from $300 to $800, $900 a month, okay, so there's an increase there. And then they say, oh, then you have, it's almost like catastrophic insurance is what it is. Then you have to pay your deductible, which could go from $500 to $1,500 a month. So you've got an increased premium, okay, and an increased deductible. My concern is I went to people in asking them, and even I talked to some people, some of the hospitals, is that my concern is that with these increased premiums and deductibles, my concern is people are not going to be going to get the care that they need. Now,
And you say increased deductible. What that means is the insurance doesn't cover like it used to.
Some of us may have had a $500 deductible. You pay everything up to that $500.
Right.
Now it's gone from $500. Clients that I've talked to, it's gone to $1,500 and more. So they're responsible out of their pocket up front before the insurance kicks in.
Our old medical programs in America were not perfect before, but they needed some adjustment. But instead of adjusting them, they brought in a Sherman tank and blew the whole thing up.
And in the last year and a half, I've been across the United States 4 or 5 times. And as I've flown or as I've driven, I've talked to people in rest stops and truck stops and at airports and stuff like that. And I would just randomly ask anybody. It didn't matter who they were. I said, how do you like what's going on here? And they said, we don't know if we can trust them.
Exactly.
We used to be able to trust our government, and I asked them about their premiums, and they said, it's really kind of scary because from what I'm being told that, our premiums are going to be going up at work. And, it's really disheartening, that, here's a government agency that's really, in essence, taken over what, our capitalism, it's not, again, that's not
Free
perfect
enterprise,
either.
yeah.
Free enterprise is not perfect. But when we have the government coming in and mandating certain things, for paying, like for you and I, well, not me right now, but people that are 65 and younger, they're having to pay for maternity, they're having to pay for things and other things that won't even be included in that they need personally.
Right.
And so we're having to pay this to cover people that need it that are younger. And, it's adding cost, to everybody. And as we've all seen, the people are more willing to pay the fine than they are to get the policy, which means fewer people are getting into the ACA as they had hoped to. They're just sitting back and paying the $1,500 fine and not having to pay all of that. And if they need help, then they'll get it because they can't be denied.
And ACA is the Affordable Care Act.
Well, that's what they call it.
I'd like to remind people that this Mr. or Dr. Gruber, who wrote, as I understand it, wrote Obamacare, was quoted as saying that he thinks that people are too stupid to realize that they're not telling the truth.
Well, I have to disagree with him on that. I knew something was coming before they even, and so I'm not going to include myself as part of the stupid group.
Well, I know, but that's what he thinks.
Well, I think I don't want to call them stupid. They were misled.
Yeah, exactly.
The people that voted for the people that promoted this, and even is it Senator Schumer, I think it is.
Yeah.
He even came out in the last week or so saying that he felt that what was voted through was not really done correctly. Here's a third man in the Senate.
Yeah.
Making a statement.
A Democrat.
Like that. A Democrat, not a Republican.
Yeah.
Saying that that they made a mistake in the way that they put it through, and he's getting a lot of shots. From people in the administration and other people in the Senate, for his coming out and being open and honest. And that's, I wish that they had been more bold. They're supposed to be our representatives.
Now, let me give you another example. We have a insurance policy in my office for the nurses that work there and things, and it was costing us $1,350 per month. With the new,
Increase.
yeah, it's gone up about $700 a month. So now it's going to cost us $2,090 a month.
And that's profit out of your business.
It's not covering anymore. It's not a better policy. It's just more expensive. Like we were talking about, I think that the insurance companies are raising their prices because, they have to cover all these people that are not paying anything.
Well, I shared with you earlier that last year in November, I went to two of the cabinet members of the governor, and then I went to 5 ladies that oversees the Kentucky version of ACA. And, when I met the cabinet members, they really didn't help me to feel better about what was going on. So I went to these 5 ladies, and one of the ladies in the room made a response that I couldn't even fathom being said. I went to them as someone that is concerned about the people that I see in my profession. And I said, it's going to put couples in a predicament to where, because they do not get the subsidies, because they make too much money, they have a choice of either getting a divorce or filing bankruptcy. And this one lady, just as serious as can be, looked at me and she said, bankruptcy is an option. And I looked at her, and I didn't use any foul language, but I scorned the lady. I said, I cannot believe you have the audacity to say that bankruptcy is an option when it comes to health care. And she said, yes.
Well, in other words, we had a very good system of health care, the best in the world, and now they've hurt it.
There was this couple that had 2 sons. I believe they were twins, and they had to be on a particular medication for their illness. Both of them had the same issue, and before they were paying and I can't remember the exact number, but it was maybe $200 a month or something like that. But it went up drastically to like $10,000 a year. I can't. I'm not going to say how much it was exactly because I don't remember. But it was an astronomical amount, and it was because they had to change from what they had, the medical insurance that was working, to the new ACA version, and now they were in destitute because they were having to fork out all this money for the same kind of care that their sons were getting prior to that. And that's devastating, to anybody.
Of course it is. Of course it is.
And I thought that
It's
it was
terrible.
supposed to reduce at $2,500.
You see, that's what you call a Gruber.
A bummer?
A Gruber. In other words, that guy that wrote the policy that says that he's not going to be honest, and that's their policy.
When I was growing up, my dad said 2 groups of people you trust, and those who are in leadership and those who are in politics, because you believe that they have your best interests at heart. And in this last 6 years, I've seen even more of that being taken away because you want to be able to believe everything that comes out of the mouth of a politician. I have a statement in my office that says, by telling the truth, that's the only thing you have to remember. And I've called our politicians and I said, this is something I believe that you need to post in your office, because if you tell the truth, then you don't have to try to remember what you said the day before, because it's still going to be the same,
Right. That's good.
And I think that that's something that's lost in our politicians, is that, you just say what you have to get what you want. And, let's manipulate the system because we have the better good, for the people.
Oh, that's a good point. They think that they know what's best for us more than we know ourselves.
Well, I said something at a conference that had nothing to do with this one here, but dare we be silent anymore? You know, because I think the more that we sit back as people in the community, you know, and don't say anything to our politicians, they think that everything's okay. And I encourage people to call their representative, but do it respectfully. Every time that I call our congressman's office, I'm always cordial with the people. I thank them for what they do. I voice my concern, and you know, and I say I appreciate what you do, because you have to listen to people like myself, you know, giving these kind of concerns. But be cordial in this. But you know, do it again in a respectful way as you call them, because
Right.
they are our representatives, and you want to feel like that they're listening to you. And you know, that's something that I encourage people to do. You know, make sure that you have the best facts you can, because there's times that I feel like calling, and I hesitate, and I go, no, I need to listen and find out some more information, because I don't want to give misinformation, you know, just to add on to what they've said as not being true. But I want to make sure that I know the facts before I do. And as I've called, you know, our congressmen, senators, and others, you know, I said, voice the concern. I said, here's some concerns that I have as I'm beginning to understand. Because, you know, again, if we're silent, it's giving them approval. You know, that
Right.
nobody's calling and complaining and saying anything about it. But if you're uncertain about, you know, certain things, call somebody that may, you know, call your doctor's office and to say, you know, are these things about my policy true?
Yeah.
And, you know, call your insurance company as well.
Well, I'd like to send you a copy of this DVD. It's got the Gruber statement on there, which I guess most people know about, but the guy that apparently wrote the Obamacare bill says that he couldn't have passed it unless he told a few
Lies.
Basically, that's what he said, and he says he thinks the people will never catch on. So it's got him saying it in person. So if you give us a call right now, we'll send you a copy of this. The number to call is 893-2444. Now, people won't believe this unless they get a copy of it.
There's not just that one. There's more like 4 or 5 situations where he said
the same thing. Yeah.
So it
yeah.
wasn't just one time.
That's right.
It wasn't a, you know, a mistake that he made one time. It was something that he said on numerous occasions. And what was really ironic in hearing Nancy Pelosi and Reid and some of the others, even Mr. Obama, is that they acknowledged this man.
Yeah.
They recognized him and said that they took lead from him and his leadership, and now they don't even know who the guy is. Nancy Pelosi said,
I never heard of him.
Never heard of him. But she spoke his name. You
Oh,
know.
yeah. Before she says, oh, I want to thank him for writing this Obamacare law or something to that effect.
He's a professor at MIT. So,
Yeah. Yeah.
And he's also lost some contracts from other states because of what he has said.
Well, this is unbelievable. You got to see it for yourself, and then you got to show it to your relatives, neighbors, and friends, because they're not going to believe it either. But we've got to know this is a very crucial situation about our government and what it's doing, and you have got to show this to other people. And we'll send it to you absolutely free because it is really important. And the number again, 893-2444. You say you've talked with Congressman Yarmouth about this?
Yeah, I spoke to him last year in December. He's very cordial. you know,
Uh-huh.
and he listened. And I hope to be able to go back in the near future and be able to talk to either him or someone in his office, you know, just to try to inquire about some of these things that have come to the surface recently.
Absolutely.
And just to try to get some more answers. And I'm not going just as a somebody of the community. I'm going as somebody who's representing the people, you know, in mental health. You know,
Right,
because,
right.
and what's concerning too is this last year when I would call fellow people that are in the same profession I'm in, and I would ask them about it, and it's like that they didn't really have much knowledge about what was going on in healthcare.
Really?
And it was really concerning, and I didn't ask just one. I've asked 2, 3, 4 people, and it's just like, what planet are you on, And,
Well, see, that's the thing. People don't realize what's going on in a lot of areas.
well, if they don't listen to, and I'm not saying to listen to just one news broadcast. I try not to just listen to one. But if you just listen to this group, they're not going to necessarily give you the information that's being addressed.
Right. Right. Absolutely.
If you didn't know about it, by watching them, you wouldn't know about it going on.
Right.
So, unless you had to go into the hospital and you ended up having to fork out more than you realize in your increased premiums, but they're not. A lot of people are hesitant about calling because they're not sure how to say it. They don't, and I ended that many years ago. I started calling back when President Clinton was in office, and I called President Bush as well. But I called to affirm what they were doing. It wasn't just negative, because I think it's one thing that my wife instilled in me. Call them when they're doing things well.
Okay, yeah.
Because if all they hear is negative from us, they duck when they see our phone call come up. Here we go again.
Yeah.
But if they do something affirming, call them up and say thank you for what you're doing.
Yeah.
Call Senator McConnell. And if Mr. Yarmouth does something that you support, then call him and let him know.
Mike, here's a summary of another lady that works in our office, and her insurance went from about $400 per month up to $551 per month. And she says that's a 36% increase in a 2-year period. So, they've done a lot of craziness in the insurance companies and making them make the premiums much higher, the deductibles are more, so they don't pay for as much, and some people losing their policy, some people lose their doctor, and all of this. And we were told, oh no, you won't lose your doctor. You can keep your doctor if you like them, and you can keep your insurance policy if you like them. So it's something that we need to be aware of, I think.
Well, I think what the deception, was, let's vote on it and let's see what's in it. The Pandora's door, open, and now you really see what the truth of it is.
Yeah.
And again, we should be able to trust our people in leadership and politics. You want to believe that they have your best interest at heart.
And we should be able to believe Mr. Gruber, too.
Well, yes. Even though he was not part of the administration payroll, but I think that's where, whether it's our politicians or whoever it is, we want to know that everything that's coming out of our mouths is the truth, and what you say to me is the truth.
Right.
And I don't have to go back 4 or 5 times to clarify what I said that was misunderstood 3 days ago and clarified 5 times by different people. When the person says something, let it be said, this is the truth.
Yeah.
I don't have to come back and clarify what I said 3 days ago 5 times. And I think it's part of the sadness that we have in our nation is that we don't know who to trust.
That's exactly right.
In my profession, as husbands and wives, we want to be able to know that what our spouse says is the truth. And we'd like to think that when we hear politicians or other people in leadership positions, that they're not saying something that's going to be deceptive, but it's going to be truthful. You can take it to the bank.
Right. Right.
And that's one of the sad things that we're seeing that's eroding.
Well, some people said maybe we've got the wrong people driving the bus.
Well, maybe we need to just change buses and all, But hopefully in this next year that we're going to see a change and a
Some
transformation.
changes.
And in a positive way, not in a knockdown, drag out type of thing, but hopefully that we will be able to work across the aisle.
Yeah.
See that happening,
Yeah.
in Congress, and that's why we put them in that place.
Right.
With their differing views, be able to come together and to work together. Even though there are opposing views philosophically and all, okay, let's come together and work together with a purpose of saying we have the best interest of the people that we're representing, whether it's Montana, New York, Texas, or wherever it is, to know that the people that we send there they're going to work together, and fairly
Everybody's good.
everybody's good,
Right.
instead of what can I get out of this.
Do you have any other points you want to make? We're
Well-
coming near the end of our program.
I don't want to end up just on a negative, but they were talking about in how it's affected other hospitals. There was a doctor's office down in Monticello, Kentucky. I even called them to confirm it. They closed, they said, because of
They
Obama.
closed the whole hospital?
No. It was the doctor's office,
Yeah.
excuse me. That they, maybe it was Somerset. It was Somerset, not Monticello. That they closed the doctor's office because of Obamacare. And then I didn't, but hospitals in the Appalachia area, they're saying that they were closing too. And I don't remember, this is an article I cut out some time ago, that they were closing them. And I'm not sure if it was directly, but I think that it was associated with the ACA that that they were having to close down, certain hospitals.
Yeah.
And when you do that, you're eliminating care for people in certain areas of the Appalachia area. As bad as, I've been in the Appalachia area and worked there in missions. And, to go to a doctor is not like jumping in the car in 10 minutes. Like here, you can be at most any hospital in a 10-minute run. And, down in Appalachia, where they're closing,
It's a long trip.
it's not a 10-minute drive.
Yeah.
It's maybe 10 minutes to get out of your holler, but it's not going to be a 10-minute. It could be a 45-minute or longer. And so when I don't just see just the impact with the people that I see, but in a broader spectrum of healthcare across the board.
We thank Dr. Mike Clark for being with us today and giving us some of these insights on how Obamacare is affecting all of us in the healthcare area. And we hope you will tune in again next week for the rest of the news.